The Shift is brought to you by SE Healthcare. Welcome to The Shift. I'm Dr. Andrea Coyle. Welcome back to the next episode of the Shift podcast. As a reminder for anyone who's new to the podcast, really the genesis of this was to get people together in the healthcare industry. I'm a nurse, so primarily nurses, but I recognize that there are a lot of people in healthcare industry that aren't nurses. But the point of this podcast is to talk about the shift. And if you remember, a shift is when you move from one place to another, from when you change position, direction, or tendency. And many of our guests are going to talk about that pivotal moment in their career where they made a shift. And then we want to highlight the positives and all the benefits of being a nurse. We're vibing on positivity. I'm thrilled and honored to have a great guest on today, Brittni McGill. Brittni's a nurse. Brittni's worked at the Norman Regional Hospital for 17 years, where she actually started off as a student nurse. Brittni believes in creating professional development, and she believes in creating pipeline programs such as System Student Nurse Partner, Nurse Extern, and Residency programs at the Oklahoma University College of Nursing Satellite School. And Brittni also helped develop several tech to license clinician roles, which, as we know, is critical in healthcare's landscape today. So thank you, Brittni, for that great work. Are you a Sooner?
Hi, good morning. Welcome. I am. I didn't grow up here, but if you're smart, you are a Sooner.
So we're going to vibe on the Sooners for a minute too, but let me finish your introduction because there's a lot of great things you're doing. I'm really excited to tell everyone about this. Brittni is the accountable leader for clinical areas and for the Center of Excellence at Norman Regional. She is a Leadership Norman graduate, a Norman Next 40 Under 40 award recipient, an Oklahoma Magazine 40 and Under 40 winner, and a Becker's Hospital Review Rising Star. That's amazing. That's awesome.
Thank you.
Brittni also understands how important and the value of creating meaningful connections and meaningful relationships. She serves on nonprofit boards and contributes to the community. And she is an immediate past board president for the Virtual Center, which is a local nonprofit for addiction services. And one thing I think is really great is Brittni provided us with a philosophy of giving back to the community. And it is through networking and partnerships, we are stronger together, and together we can make a very positive impact on the community, which is powerful. So thank you, Brittni. We're going to get started. Did I miss anything that I should be sharing with our fellow shifties?
I don't think so. Hopefully we'll talk a lot today about the power of community partnerships and innovation and just the freedom to try different things.
I love it. The freedom to try different things. That's what the shift is all about. My first question is, I want you to share a moment in your career, Brittni, when you actually shifted, and you could have shifted your mindset. You could have maybe shifted your career role, like what you were doing within the healthcare system. So talk to me about a shift.
Sure. So for me, the shift happened around workforce development. So I started this role rather young and inexperienced, in all honesty. And so I came in with a different lens. I remembered what it was like to be a student. I was a nursing student within this organization. And I remember how easy that transition was to professional practice because I had basically had a year-long orientation. So you fast forward to the maturity around residency programs, which is great, but that happens after graduation. So what could we do before students graduate? And that's where I really shifted my entire mindset, collaborating with academic partners across all of the local nursing schools, across different disciplines throughout the state. And that is where we really started to rapid fire implement innovative programs and roles. And so when I think about my job description. Yes, there are words on that document, but it's all about creating needs and coming up with solutions to problems. So, I have a tendency to kind of color outside the lines, but I have that freedom to innovate. And so we started to pull in our community partners, and we each have two separate silos, the academic sector and the professional sector. And we just openly shared, what are your challenges? What are your barriers? And we flipped the whole thing upside down. And what I mean by that is we started to participate in the curriculum being taught to students. We started to share, this is what we need your students to learn in order to be successful upon graduation. This is what we need to do to collaborate to smooth that transition. And what we've seen are tremendous results in recruitment and retention efforts across all of our disciplines. But that's excited nursing, and it's also excited the faculty. And we've also, as a result, created hybrid roles between the two. So when you think about the other elements that we're trying to tackle, which is employee and clinician well-being, giving clinicians the opportunity, and nurses specifically, to play a part in healthcare's future by training them fills their soul. And it also gives them reprieve from the bedside. So it's just hit on multiple initiatives, pulling it and packaging it together. So that is my shift that just continues to evolve. I do share this a lot. I loved Friends. I still love Friends. And there is an episode where Ross and Rachel are trying to get that darn couch up the stairs. And he just keeps screaming, pivot, pivot. And that's kind of become our internal motto. We're going to start something and we are going to just keep pivoting until it gets better and better and not end, really. We can always improve. So for me, that's been kind of one of my proudest initiatives, and the shift that just keeps shifting.
I love it. And I love when you say pivot, and again, shifting, pivoting, kind of the same. But for the sake of this podcast, because we chose the shift to be our name, we can't change it to pivot now because we can't have pivoters. We have to have shifties. But anyway, it's so important in healthcare, especially as nurses, to be able to think outside the box. And what I'm hearing, and just my experience collaborating with you, you are very, you think outside the box. You have this great ability to literally shift. And when you shift, you make a difference. And really, isn't that why we got into healthcare? We want to make a difference in the patients that we serve. We want to make a difference in the student nurses that are coming into the profession. And I believe nurses, through everything that you described, make the impossible possible. And that's what we do. Tell me a little bit about what your role is as the chief nurse at Norman Regional. What is your role in helping shift the profession of nursing in a way that's positive? Because, Brittni, right now we have there's negativity out there in our healthcare space. Too much with too little, more with less, geopolitical issues, the burnout. I want to change that. It's now the B word. Some people don't even like to say B word. Nurses don't want to hear, let's be resilient, because we're the grittiest, most resilient people on planet Earth. So tell me what it is how you want to shift the profession of nursing, and what's your role in that?
Sure. So I am trying to be that visionary, trailblazing leader that demonstrates it can be done. But I've also learned over the years how I and our leaders collectively have to intentionally connect dots, blatantly connect dots. Otherwise, the neurons may not fire that direction, right? That this is what we're doing. We are shifting. So nurses, like you said, yes, incredibly resilient, great critical thinking skills, problem solvers through and through. And what they need is someone to remove barriers for them. They will figure out all the rest. And so What we've done over the last several years is shift and refine our professional development ladder program that gives decisions back to nurses, that gives them the autonomy to pick projects they are passionate about that impact their daily work. They know what needs to be done. We as leaders don't need to educate them on that. So by having that program and then the structure of what we call unit-based councils, which is not a new concept, but we've married those two things together and given them the opportunity to come up with solutions to problems in their daily work. And that has inspired motivation for others to hop on board and start to create team-based projects. And we've got departments collaborating across the system, and it's become bigger than just any nurse. And so I can give you a couple of examples of that specifically. So we have a very engaged vascular access team made of all nurses. And we had a challenge where when a patient needs a central line, we had several different physicians that could do that, but the process wasn't standardized. So this team, who serves on statewide committees related to their profession, they all have certification, came together and said, we would like to present to the Oklahoma Board of Nursing and ask that nurses be able to place central lines. I said, all right, I'm going to support you. I'm going to champion this, but this is what it means to gain approval throughout the organization to support that board request. And it took us about a year, but in January of this year, we did it. So here we have taken an entire frontline idea and concept, given them the support, both internally and externally, to do something that has made a significant impact on patients. And it wasn't easy, but we got a great product in the end. And so, that's what excites me. And those are the stories that, we have to tell to motivate others that it can be done.
Brittni, that's a really great story. It really speaks to nursing excellence. It speaks to the shift of how you went from one way of doing it to moving it to a different way of doing it. It was a mindset shift. Just a lot of great takeaways from that story. Tell me a little bit about what Norman Regional is doing right now to address burnout. I know that you're working with SE Healthcare, which I'm the Chief Clinical and Innovation Officer there. Tell me about your vision. You said something so powerful to the SE Healthcare team, and I'm hoping you'll share it. Talk to me about your vision about bringing on SE Healthcare's Nurse Burnout Prevention Program. It's actually a burnout prevention program. You're going to take it to all of your healthcare providers. So you're going big or go home. Brittni said, I'm going big or going home. And I like that vibe. So tell me about your vision.
Sure. So what we have learned and what I have learned is that this concept of burnout or resiliency, wellness, it all means something different to the individual. People's threshold for reaching that and acknowledging it is different. And then how the individual is impacted by those interventions is different. So we were really looking for a system-wide solution that would give people the individuality they needed to truly make a difference. And so, our story from Norman Regional side is that we were presenting at a national conference, and we ran into the folks at SE Healthcare, and we started, listening to how that platform could help our nurses. And you're right. I thought they are nationally recognized. This program would be great for nurses. However, I don't want to be the leader that just provides a resource to a pocket of individuals, because our organization takes all kinds, all caregivers, whether you're directly in front of the patient or not. So we did a pilot presentation over this past winter, and we invited non-clinicians. We invited we had a pharmacist there, we had a paramedic, we had an HR business specialist. We invited students and our academic partners who came that don't even work here. They just rotate through clinicals here. And the results from that pilot were, I mean, I was absolutely blown away. So much so that, yes, you and I collaborated, and we are proud to be, you know, the first organization that's going to take this program system-wide. So we call our employees or staff healers, because we truly believe that no matter what your role is, you are healing the patient directly or indirectly. And so we wanted to offer the same platform and program to every healer within the organization. So what I love about it, and the results had shown through that pilot, is that people were using different aspects of the opportunity because that's what was meaningful for them. And if you think about, you know, the stressors internally and externally, no 2 days are the same. And so you can go back to this platform and look for a different resource to fill that need. It isn't a one size fits all. And I think that's the only way we're going to be able to change this collectively together is by, you know, just as we treat patients individually, treating our healers individually too. So I am super excited to see how this launch goes. I know it's going to be great, but really the results of it.
And I'm so thrilled. And I heard a couple little takeaways that I had to write down. I love that you call your care providers, your care team members healers. I think it's so appropriate. I think it's so inclusive, which is incredibly powerful, that you as the leader with, I think it was Keith from HR, you two really took this on and said, you know what, we need to do this for everyone. So it was a very inclusive approach. So kudos to your organization. The other thing is, and when you mentioned people were able to go into this program and self-select what resonates, what micro learnings, what nuggets of knowledge speak to them, that gives people autonomy. And at the end of the day, if you think about how we really want to mitigate burnout, we want people to feel empowered. Isn't that what we do as leaders? We want
Yes.
people to be empowered to make decisions, whether those decisions are for care delivery or those decisions are for themselves, for their own self well-being. So I think you hit a lot of really, really good points. Let me ask you this. Do you think it's going to change the culture in Norman Regional by bringing what burnout looks like, feels like, smells like, sounds like? Do you think that's going to change the culture?
I do. I feel confident about that. We internally have a wellness committee, and we've surveyed that wellness committee, and we've addressed the elements of burnout, which, you know, those assessments have confirmed, but we haven't been able to move the needle on doing something that produces a better result. And I'm confident that this platform will. And that is what is going to, I think, just the dominoes are going to fall. And yes, we are going to see a cultural shift, because this will finally be something that, like you said, is inclusive, it's individualized, it's meaningful.
Mm-hmm.
And I think that there's also, you know, an element of recognition in this, that, you know, if people want to be private with their own, you know, thoughts and feelings, they can, but they're also being supported privately. And I think that that's, you know, important as well. Structurally, it's easy to work through and navigate. There aren't lots of layers that make the platform challenging. And so when you have on-demand, easy access, that lowers any level of frustration, you know, our healers would have. And so that too just creates another aspect of positivity. And so it's going to be great.
I love it. That's so well said. And you know what, here's what comes to mind for me. One of the micro learnings is about venting. Is venting healthy? Is it helpful? And the answer is not really. But venting, if you think about a culture, venting is an action or a behavior, and that's part of culture. within that micro learning, if people can recognize from that micro learning that venting isn't healthy, and how to talk about what your issues are, what your concerns are in a healthy way, that is one example of how slowly but surely it will change the culture.
Mm-hmm. You know, when it comes to venting, I do believe some people just need a safe space for that emotional release. And so, I mean, I personally have given people the permission to come vent to me. If you need that emotional release, I would rather be the recipient of that than for that emotional release to be in an environment that doesn't have someone willing to receive that. And so I hear what you're saying. We do try to encourage our professionals to have a professional conversation, come with a solution, or idea, not just spill all of our woes and problems. But, this platform, I think, helps with that too. It's just so many benefits.
Yes. So, Brittni, one last thing. If you could give all of our shifties 3 takeaways that will help people be interested, involved, included, and inspired, give a couple takeaways.
Okay, so last night while preparing for this, I ran across something by happenstance on LinkedIn. I do love alliteration, so there are a few of them here, but I think that being a mission-inspired motivator, number 1, having high energy is infectious. Having the stamina to demonstrate we can do the hard things. You've got to be able to rally the team. You have to be able to inspire and energize others to push through challenges, and all for the sake of the mission. So that's my first. You've already heard I like to partner. I like to lean in on our community resources. So number 2 was community building collaborator. And we just have a history of being able to partner with experts outside the organization that just make both sides of the equation stronger together. And then being a courageous decision maker. Sometimes somebody just needs to stand up and say, this is what we're doing. And if we made the wrong decision, we'll own it, we'll pivot, we'll move on. But sometimes you just have to be able to jump out in front and get off of high center. And so I'm typically willing to be that courageous person and own it later if it was, the wrong one. And then I added a 4th because I loved this statement, be a tenacious implementer. So pulling together on, energy and collaboration and motivation. And I just love that word tenacity, because I think that's how you need to be in healthcare today. It's too easy to get sucked into the negativity. So, rise above it.
Those are so fabulous, Brittni. Thank you for sharing that. I have to tell you, we met many, many months ago, but after this 25-minute podcast, you've inspired me, you've motivated me. I want to thank you for everything you're doing for Norman Regional. I want to thank you for everything you're doing for the profession of nursing. Every shift that you have made makes a difference. Enjoying the shift? Help us reach more nurse leaders by rating and reviewing us on your podcast app. It takes just a minute, but makes a big impact. Search for The Shift, tap those stars, and share what you love. Your feedback shapes our future episodes and helps others discover us. Remember, rate, review, and amplify The Shift today.